In 2014, the world was shaken by the news that the Ebola outbreak in West Africa had risen to a global threat. The virus was spreading uncontrollably, the fatality rate was very high, and the doctors had no treatment options. Today, humanity is facing multiple grand challenges like Ebola. Some of these spike as sporadic events, like floods, hurricanes, and wildfires, while others build up over time to crisis levels, like antimicrobial resistance, income disparity, and global warming. It feels like our own success as a species has created its own problems, and we entered a new era of increasingly difficult and highly complex grand challenges. So the question is, how do we tackle such issues? Well, our current MO is to enjoy the comfort and security of our daily lives and then start throwing resources at the problems only when they arise. Take the Ebola epidemic, for instance. The first infections were announced around March 2014. And for a while, we hoped that the existing infrastructure would just solve the problem. But soon, the virus penetrated into the densely populated capital cities of Guinea, Liberia, and Sierra Leone, and then WHO sounded the alarm. This time, dozens of countries were willing to chip in. They dedicated hundreds of millions of dollars to outbreak response. They even deployed their military for field operations. WHO coordinated the efforts of 115 NGOs for contact tracing, for treating patients, but there was a problem. The virus continued to kill people. So we were in a dire need of a vaccine. All this money, all this effort, but we still needed time to develop such a high-tech solution, time that we didn't have at that time. So it took 5 years to develop the first vaccine, but in the meantime, we have lost 11,000 lives, 40% of the infected. So throwing money at the problem did not save these people. This is the first lesson to be learned from the Ebola epidemic, that we must be prepared when these disasters strike. I mean, I keep myself asking, if we had learned that lesson by then, could we have been able to save hundreds of thousands of people today? I'm afraid the answer is yes. So we can't afford to wait for crisis to happen, but we must be prepared. But then, how can we be prepared for these disasters that are so unpredictable? Indeed, for most of us, Ebola was totally unexpected. I mean, we had heard about it a couple of years ago, here and there, but it never occurred to us that it could lead to such a global problem, such a global threat. But in fact, since the first one in 1976, there had been 18 different Ebola outbreaks. 18 different warning signs of a highly deadly virus. And when the biggest outbreak hit us in 2014, we were painfully unprepared. Today, we are going through the COVID-19 pandemic. Was it possible to predict it? There had been 2 coronavirus-related epidemics before. The first one in 2003, the MERS epidemic, which killed 800 people and infected 8,000. The second one in 2012, it killed 1/3 of the 2,500 people that it infected. In 2012, the Robert Koch Institute of Germany drafted a public protection report which detailed a scenario of a possible coronavirus pandemic. And that scenario came astonishingly close to what we are going through today in terms of the number of cases, the number of deaths, and even the timing of the waves. And the report also estimated that the impact on people and economy would be at a level E. And guess what? Level E was the highest degree on their scale. So we knew that a pandemic was totally possible, So the problem is not that we are blind to these future events. The problem is that we fail to act on this information. We tend to downplay it. But so how can we care to prepare? If we know these disasters are likely, how can we care to prepare for these events? Well, for some of these disasters, we are already prepared. Imagine yourself entering your car. When we do enter our cars, we instinctively reach for our seatbelts just to save ourselves from that highly tragic and potentially disastrous traffic accident. Municipalities, they keep ready a firefighting unit 24/7 just in case a fire incident happens. But for some other potential disasters, we are unprepared. We don't yet have solutions. But at the societal level, we seem to continue ourselves relatively unbothered. Perhaps we don't really grasp the devastating consequences because we attach such a low probability to that. So we need to change this. We need to understand that disasters happen, and when they do, they have dramatic consequences. Luckily for us, there are some people among us that have a different perspective, that prepare for disasters. In 1999, 3 scientists at Public Health Agency of Canada, Stephen Jones, Heinz Feldman, and Ute Stroer, started their research on developing the first Ebola vaccine. At that time, it was already agreed upon that Ebola was a highly deadly virus, it was very dangerous, and it was even a bioterrorism threat. But the funding agencies were not willing to dedicate their limited resources to this issue. For them, other health issues were more pressing. So it took 4 years for these 3 scientists to raise half of the money that they needed. And when they did, they have been able to produce and set aside a batch of vaccines just in case they would be needed. Think about it. One could easily go and say in December 2012 that this was a total waste of resources, but in 3 months, in just 3 months, that batch of vaccines was perhaps one of the most valuable things in the world. And the West African Ebola outbreak wasn't even the first case in which this vaccine candidate was even used. It was even in a more unlikely event. On March 12, 2009, a virologist in a Hamburg research institute pricked his finger after a mouse experiment, and the syringe contained the Ebola virus. This happened in a biosecurity level 4 laboratory. Biosecurity level 4 is the highest security level that you can get, yet on that day, the syringe found its way penetrating through 3 layers of gloves of that scientist. And that scientist, who is still alive, by the way, was the first person to receive the vaccine candidate. So we have a laboratory accident, an Ebola epidemic, a coronavirus pandemic. These disasters happen no matter how unlikely they are. And in fact, for instance, the coronavirus pandemic was estimated to happen once in 1,000 years, and here we are living that 1 year in 1,000. So these disasters happen, and when they do, they have dramatic consequences. So we need the mindset of people like Jones, Feldman, and Stroer, who do not shrug off a potential disaster, who do not seek comfort in a false sense of security, but choose to be part of a solution. They choose to be proactive. They choose to be prepared. Granted, preparedness is difficult, especially for the kind of issues that we are talking about. These issues require enormous amount of resources for a potential solution, and no one person, no single company, and no sole institution has all the resources necessary for coming up with potential solutions. So what we need to do is simple. We need to just combine these different people, different institutions, and different companies such that they can partner up to combine their different resources, expertise, and capabilities to find effective solutions for the problems that we are facing. This is how the Ebola vaccine was eventually developed. Hundreds of governments dedicated hundreds of millions to the development of the vaccine. Two companies, New Link Genetics and Merck, combined their biotechnology and vaccine development expertise. Logistical capabilities were needed for running clinical trials, so Walter Reed Army Institute of Research, CDC, and BARDA partnered up to conduct phase 1, 2, and 3 clinical trials. Gavi Alliance ordered 300 doses of the vaccine, and distribution and vaccination was undertaken by WHO and Médecins Sans Frontières. So the Ebola vaccine is the product of not one, but multiple partnerships. I conduct research on partnerships in the context of grant challenges, and the good news from my findings is that whenever an outbreak happens, we see a dramatic increase in the number of partnerships, and these partnerships indeed accelerate drug development. The bad news is that, meanwhile, other research comes to a halt, and it still takes too much time, the time that we don't have to come up with a drug. So what we need to do is to do the following. We already have the existing capabilities for partnership. What we need to do is to just combine it with a mindset of preparedness. Preparedness and partnerships. These are the two things that we need to keep in mind. Preparedness for potentially disastrous events, no matter how unlikely they are, and no matter how much resistance we get. And partnerships for the solution that no one can invest alone. Preparedness and partnerships. So you can start small. You can start with having that earthquake kit ready at home, just in case a tremor strikes. You can advise your workplace to keep an automatic defibrillator on hand, just in case a colleague gets a heart attack. You can join your institution's risk management team and look out for potential disasters and always advocate for partnerships and preparedness. Invest in solutions together and never get caught by surprise when disaster strikes. Thank you very much.